The Marty and Laura Show is brought to you by Veterinary Village. With locations throughout Wisconsin, Veterinary Village is dedicated to enhancing the quality of animal and human lives today and into the future. Welcome, everybody. Welcome to the Marty and Laura Show. I'm your host, Laura Reeves, and my dear friend, Dr. Marty Greer. And we are together again, and we're talking about kind of an important topic. We've been going through the various systems of our pets, and we're going to focus today on kitties. And we're talking about bladders, just like the whole system of bladders and bladder stones and all of the things that can happen in the feline and next week canine bladder. So, how you doing, Marty?
Good, and there's so much to talk about.
You told me before we came on air, you told me that there was 300 pages to review just to talk about this. I'm like, oh my God, it's cats bladders.
Yeah.
Wow.
There's so much that we know, and there's so much that we don't know, which is even more frustrating. So it's a pretty interesting topic.
Excellent. So start with, I guess I would say, the most common things that we see with our cats as regards like bladder function.
Failure to use the litter box as prescribed.
Right.
So
We
that
talked
may
about
mean
that. And is that,
yeah,
you said behavioral, but also it can be physical. Is that right?
yeah, and many of the cats that have this problem do have a medical condition.
Mhm.
It can be bladder, it can be kidney, it can be diabetes. So let's just try to focus on the urinary tract to
Just
start
the
with.
bladder.
Yeah, just the bladder. So the first thing to do if your cat is failing to use the litter box as prescribed or is making frequent trips and prolonged trips to the litter box,
Mm,
that's something that really needs medical attention. The first thing you need to do is rule out the possibility of a medical condition. And it is really common for cats to have bladder disease, but it's not a bladder infection in most cases. And this is where it gets confusing for people, is that people and dogs get bladder infections from bacteria. Cats almost never have that as a primary underlying problem. They have other conditions that cause symptoms that look like an infection,
mhm.
but in reality, when we collect the urine and do a culture and look at it microscopically, most of the time, at least with the early onset, the first couple of episodes that they have of this, it's typically not going to be bacterial.
Hmm.
But this accounts for around 1.5% of all cats that are seen at a veterinary clinic. And I was just reading through
Oh,
some
wow.
of the stats. This accounts for 500,000 cats a year in the United States having this condition.
Wow.
So 500,000 is a lot of cats.
Mhm.
So it needs to be taken seriously. And if you aren't sure if it's medical or if it's behavioral, you really need to take your cat in, get an ultrasound of the bladder. So try to get the cat into the carrier early enough before the appointment that they're not back and forth to the litter box 12 times between the time you schedule it and the time you get there. So try to get them into the carrier a couple of hours ahead of time. And when you get to the vet clinic, expect that many of them, not all, will want to zip your cat to the ultrasound machine and quickly get a urine sample before the cat has a chance to empty the bladder again, because when they have this irritation of the bladder, they urinate small amounts frequently, so it can be really tricky to get a urine sample. If they have kidney failure or diabetes, they have buckets of urine. That's easy. If they don't have those conditions, if it's bladder, then it can be a much more difficult proposition to get a sample.
I mean, this might be TMI, but how does one get a urine sample from a cat? Like I know how to do
Oh,
it with a dog, but
right.
let's just kind of give people a behind the scenes
Sure.
because that's
Well,
tricky.
Well, we typically do dogs and cats pretty much the same way. We do not take the dogs out in the yard to urinate into a cup because it's unlikely that you're going to get a sterile sample, a sample that's not contaminated by passing through the urethra. So
Mm.
we do dogs and cats in our practice the same. And that's we take you to the ultrasound machine, we put you on your back in a nice soft tray with somebody whispering nice things into your ear, and we put the ultrasound probe on the bladder, line up the bladder with where our needle wants to enter, and we go directly into the bladder with a needle and syringe. And it sounds kind of gruesome, but it really doesn't bother the dogs and cats. Puppies, they're a little tough because they just don't want to be on their back. But most adult cats and dogs are very cooperative for it, and we don't mind in our practice even having the owner in the room for a good part of it. In some practices, that's not their norm, so I can't speak for what every
Mm-hmm.
veterinary clinic is going to do. But we can see where the bladder is, and that does a couple of things. One is it allows us to get a sterile sample really nice and clean through the abdominal wall, in and out quick. It takes under 30 seconds, and it's a nice, sterile, clean way to do it. It also allows us to see, are there stones in the bladder? Are there blood clots in the bladder? Is there a tumor in the bladder? Is there some other pathology going on that we need to be aware of? If there's a tumor, the recommendation, or if you suspect a tumor, the recommendation is to not do this needle and syringe called cystocentesis. The recommendation is to collect the urine sample by a voided sample, and that does require some special techniques. 3 samples collected on 3 different occasions, blah, 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 sent into the lab looking for a tumor. We rarely see bladder tumors in cats. I think I've seen 2 in my career. We see bladder tumors in dogs a couple of times a year, not all the time, but often enough more in a dog that you're going to say it's more common in dogs than cats.
Okay. Okay. Um, okay. That was, I wanted to get to the
Well,
collection part because I
but
think it's
but there
fascinating.
is but there is a second opportunity, and that's if you have a cat that does have such severe bladder irritation, you literally cannot get the cat to the clinic and on the table quickly enough. There
Mm.
is a non-absorbent kind of cat litter. There's at least one brand called Nosorb. It's little black beads that are plastic, so that when the cat uses that as a pseudo kind of cat litter, the urine doesn't soak into it the way it does into the clumping or the clay litters. So you can then pour it off of that and into a sample cup that you can then take to the veterinary clinic. So
Oh,
that's the alternative. There are kits that you can buy on Amazon that one's a dog kit, one's a cat kit. The dog kit has a long stick with a little cup on the end of it, so you can go out in the yard and collect the sample. The cat sample has that pelleted non-absorbent litter in it, and then you can collect the sample. And they actually have dipsticks in those kits, so you can um, check the urine at home and see if there's any indication of blood or what the pH is. And
oh,
those are really important indicators in dogs and cats for, is there bladder disease happening? It also can check for glucose and ketones, again, checking for diabetes. So these little kits that you can purchase they're actually pretty handy.
that's tricky doodle. I've not heard about that.
Mm,
Uh, okay. So cats and their bladders is a whole thing. And so,
sure.
do you see bladder stones frequently? You said you don't see tumors. So
Right.
bladder stones and the difference between bladder stones and kidney stones is a whole thing.
Well, they can start as the same source. They can both start in the kidney or they can just start in the bladder. If they start in the bladder, they stay in the bladder. If they start in the kidney, they may stay in the kidney or come down the ureter and into the bladder. And if it does pass through the ureter, it's as painful as it is for a human passing a stone. So we need to address that as well. And those can be difficult to see on ultrasound. Those are typically found on X-ray in cats. But yes, we can definitely see bladder stones. The other thing that we frequently see in cats is not quite a stone, but it's that crystalline material that is gritty and fine, more like sand, and that will eventually form into stones if you don't address the cat's medical condition with the appropriate diet and medications. And so if a cat does urinate, for instance, while we're collecting the sample and you're crazy enough to run your finger through it, you can actually feel that gritty material in the urine. It can be that significant. So these are real concerns. The biggest problem is, well, twofold. One is that when the cat's not using the litter box and it's soiling the house, that can be a life-threatening condition because there's only so much of that that an owner is going to put up with. The second concern is more common in males than females, and that's that they can have a urinary obstruction. Now, we can see them in dogs as well, but they're much more common in cats, especially male cats. Female cats rarely obstruct. They can, but they rarely obstruct. But male cats very frequently will have a urinary obstruction, and that is a true medical emergency. You can only go so long without urinating before you become toxic and the bladder can rupture and or you die of a metabolic condition. So if your cat is going to the litter box frequently and you're not seeing urine in the box, you need to go to the emergency clinic. This is not something that you can mess around with. This requires immediate attention. Within 24 hours, the urine turns into a port wine color instead of urine colored. And within 36 to 48 hours, these cats are going to be deceased. So
Oh, wow.
don't wait. Yeah, if it happens on Friday afternoon, you can't wait until Monday to go in. This is a medical emergency. So it has to be taken seriously.
What causes a blockage in a cat, particularly a male cat? Is it like structural, or what is going on with that?
Well, it's a combination of structure and these gritty materials, and that grit will
Mm,
either develop into stones that can cause an obstruction or just accumulate enough. It's like trying to pour sand through a funnel. You
mm,
can only put so much sand in there before it packs tight and it causes an obstruction. So it's a combination of that, plus the reason male cats obstruct more often than female is there's a structural design flaw that males of all species have. That's called the penis. So the urethra has to go through the penis. It has to go over the pubic area in the pelvis, and it has to go through a narrow penis. And so that's why males are more likely to obstruct. Females have a short, wide urethra, which makes them more likely to get a bladder infection of bacteria, but less likely to obstruct because the urethra is wider and more short, and so it's easier for a female to pass stones if they do develop. So therein lies the difference. We don't frequently see obstructed female cats, but it is a possibility. So just because you have a female doesn't mean you can completely disregard it. If you go to the litter box and the cat has even a little bit of urine and the cat is eating, the cat's not obstructed. If the cat is not producing much urine and is not eating, you need to hightail it to the emergency clinic because those cats are going to be really sick and it's very painful. They make a very characteristic sound. You can almost diagnose them over the phone when you hear the cat in the background going, "Roar." It's this deep, very guttural kind of sound. Almost sounds like a human baby. Very guttural. Almost that's the only time that we hear a cat make that sound. So when we hear that, when we hear the history of the cats not using the litter box correctly, they're using the laundry basket or the bathtub or the pile of plastic bags or whatever it happens to be. The cats are not using the litter box frequently. They're going outside the box or they're going to the box 15 times in an hour because they're so uncomfortable. You need to see if are they eating. So if you're not sure, open some of your favorite cat's food, canned or whatever it happens to be. See if they eat. If they run over to the food dish and they eat, you can wait until Monday.
mm.
If they don't eat or if they're vomiting and they're making that sound and they're frequently trying to urinate, you have an emergency on your hands. So the reason that cats develop these stones is we don't really know. How's that for an answer?
That
So
was,
Carl Osborne,
I was gonna get you back here, so I'm saying.
more than 50 years ago, Carl Osborne was at University of Minnesota and started working on this project along with a number of other people. He's certainly not the only person, but
Mhm.
he initiated a lot of these projects that went on at University of Minnesota. And then Jody Lulick has spent his entire career, and then he retired, and we still don't know. So these are people who have spent 50, 40-year careers looking for why do cats get this problem. And I'm a clinician. I go in the exam room, I see a problem, I fix it, I'm good. I move on to the next patient. If I had spent 40 or 50 years looking at a medical condition and at the end of my career I still hadn't figured it out, I would be uber frustrated by that limitation.
Send me right over the
So,
cliff, so
yeah. So I have to say, I'm thankful that I'm not a researcher. I'm much more satisfied being a
Mm,
clinician. But we used to think that it might have a viral component. It might have a mycoplasma component. It certainly doesn't have a bacterial component because people have cultured urine on cats for a gajillion times, and there's no consistent bacterial condition that causes this. But we know how to manage it. So not being able to find a diagnosis is different than not being able to manage it. We know stress plays a role. We know that medical metabolic conditions play a role. We
mhm,
know a lot of things about it, but we don't know what the underlying cause is. So therefore, we can't completely eliminate it. We can only manage it when it happens. So it's pretty common, like I said, and 50 to 80% of the cats that have this medical condition, if it's not adequately managed, will have it again. So if you've just dropped five or $10,000 on your plugged male cat and you don't follow the medical directions, including dietary requirements that you have been prescribed, shame on you because you're going to have a
mm.
50 to 80% chance of that coming back. And many people on the second occurrence are like, I can't afford it anymore. Well, yeah, I understand that. But follow the rules, follow the directions, especially the dietary ones that your veterinarian gives you. And there are urinary diets on the market that are over the counter, but they're not the same level of controlled pH and controlled mineral content that the prescription diets have. So if your vet says you need to be on a prescription diet, and the three big ones are going to be Hills, Royal Canin, and Purina, if
Mm,
your cat needs to be on one of those, you have to feed exclusively that diet. You can't go out over the weekend when you ran out of food and run to Walmart and pick up a bag. You can't run to the grocery store. You can't order something else from Chewy. They are prescription diets. They are prescription for a reason because we need to make sure your cat is on the right one.
Mhm.
And you need to follow those directions very, very carefully. No sneaking canned food, no putting the bowl on the floor after you eat your cereal in the morning or ice cream at bedtime. No letting him go over to the dog dish and eat dog food. No, none of that can go. Your cat has to exclusively eat this diet if you expect to have the level of control that these diets have the capability
Right.
of doing. And that's by managing the pH. And some bladder stones, there's different kinds of stones. Some bladder stones need a high pH, some need a low pH to keep from recurring. And many of them need a mineral content that's very closely to a minimum amount so that the minerals that your cat is eating don't turn into minerals in the bladder and then turn into these stones.
Okay. So diet is like 99% of what is behind this. Is
Yeah.
there a diet, like, let's just say I have a boy kitty and I don't want him to get stones, and I don't really want to put him on a prescription diet because that's hella
Mhm.
expensive, but I want to feed him a diet that's going to make it less likely that
Mhm.
he's going to develop a stone. What are there recommendations around that?
Well, there are many of the counter products that have those claims, so I would stick to one of those. And the other really important thing is to make sure that they're drinking enough.
Mm,
Cats are desert animals. They tend not to be big on drinking. So you need to manipulate things. That might mean canned food once a day. That might mean a water fountain for your cat that is more interesting for the cat to drink out of because the water is fresh and moving. That may mean leaving the tap on in the bathroom so it just has this little tiny stream because cats love to drink out of the kitchen sink or the bathroom sink, the bathtub, things like that. So those little things can make a big difference in the amount of water that your cat is willing to drink. Making sure that the bowl is washed on a daily basis so it doesn't have that icky film in it that makes the water taste bad. If your cat likes ice cubes, you can float little ice cubes in it and make it fun for the cat to play with.
mm,
You can add some flavorings to the water. There's a lot of things that you can do to encourage the cat to drink, but cats, being desert animals, inherently have a very concentrated urine, and that's one of the contributing causes of this. So the more dilute the urine and the more frequently the cat urinates, the more likely they are not to have a bladder problem. The other thing that's kind of interesting is we see more of these bladder obstructions between December and March. And that's because the days are shorter. And so cats, being the lazy creatures that they tend to be, short um, days and long nights in the winter, just don't get up and move as often. So if the cat isn't going to the litter box frequently because their bladder's not full and they don't care and they're sleeping on the couch in the sun and they're very happy where they are, then they won't urinate as frequently, and that again contributes to the formation of these stones. And stress levels. We've talked on occasion about stress in cats. What causes a cat to be stressed? Well, everything that you do
hair?
that's different in your house. Yeah, anything that you change in your house can stress your cat. And this is kind of an interesting aside. When I was first out of vet school, I had a cat, and my parents came to visit in my apartment, and she was like, hello, there are people here. I don't care for these people. And they weren't really cat people, so they're looking at me like, okay, your cat goes to the litter box every 20 minutes. Like, what is the deal here? Well, I asked Carl Osborne at one of the meetings very early in my career. My first year out of veterinary school, he spoke at one of the conferences I went to. And I went up to him at the break and I said, Dr. Osborne, can you tell me if stress plays a role in cats with bladder disease? And he said, absolutely not. Well, guess what? It absolutely does. So there are definitely contributing factors to stress, and anything that you change in the cat's life can stress them. So now some of the pet foods, the cat foods that are prescription, are to manage stress. So CD is the Hills product. They have a stress management. They have a multi-cat. There's multiple diets that Hills has for bladder disease. Royal Canin has one called Calm, and that contains tryptophan. So there's no drugs in any of these prescription diets, to be very clear. They are prescription because of the way that they manipulate the ingredients and the nutrients, but
Oh,
not, there's no drug in any of them. So the calm diet has tryptophan, the same thing that we get when we eat too much turkey at Thanksgiving that calms the cats. I actually had one client that was feeding calm to his cats. He had two, and he said, my cat is too calm. So he started mixing the calm diet with the regular diet and kind of got that nice middle ground. I'm like, what is too calm for a cat? I mean, that's great. I'm glad she's happy to live with. So there's definitely contributing factors to this. So keeping them from having too much stress if you can avoid it, like don't have the neighbor dog come over and stare at them through the screen door, or if somebody comes to visit, give your cat a nice quiet place to stay so that they're not tortured by the toddlers that are racing through your house shrieking. Trust me, I just spent last weekend with toddlers shrieking, and so I get it. So
Clearly, I am part cat because
yeah, shrieking kids is a bit of a problem. So you want to manage their stress, manage their water intake, manage their diet, and then we start talking about, are there drugs that can be helpful?
right.
And that's where really it becomes a really important thing. And if your cat does have a stone and your veterinarian needs to remove it surgically, then that stone needs to be sent in for analysis because different foods manage different kinds of stones.
Ah,
So it gets complicated to say, well, is this a calcium oxalate stone? Is this a urate stone? Is this struvite stone? Struvites are the most common, and those we can manage the best, but they are certainly not the only kind of stone that we see. So some of the diets are able to walk the line because if you get the pH too high, you get one kind. If you get it too low, you get another kind. So they walk the line of keeping that pH exactly at 7.0 or very close to that so that it can be well controlled. So why are the prescription diets more expensive? Because they cost more to make.
mm,
So they have to, in these prescription diets that are much more controlled than the over-the-counter diets, the pH is very tightly controlled by the ingredients, and the amount of magnesium, phosphorus, and some of the other minerals, calcium, and some of the other minerals are again very tightly controlled. So they're high enough that the cat's meeting their minimum requirements, but low enough that they're not having extra that can make their stones start to form. And that requires things like hand deboning the meat. So when beef or chicken goes through the machine at most pet food processing plants, little bits of bone will end up in it, not big enough pieces to cause a problem for
mm.
most pets, but enough that it'll cause too much calcium, too much magnesium, too much phosphorus, things like that in the diet. So this is why the prescription diets are prescription and are more expensive. And that's hard for a lot of owners to understand. They're like, well, but it costs so much. It's this much more to buy prescription food, and it's this much more if your cat has an obstruction.
Uh-huh. Mhm.
Doggett simplifies the puppy buying journey by connecting families with the perfect breed and responsible, health-verified breeders. They are the only breeder marketplace that verifies health clearances and responsible breeding practices. Through their personalized puppy matcher tool and matchmaker services, they educate and guide buyers every step of the way, ensuring a seamless process and a perfect match for their lifestyle. From initial breed consultation to introductions with top breeders, Doggett makes responsible puppy ownership easy and stress-free.
Dog breeding is more than a hobby. At its best, it's an all-consuming quest to create something lasting and beautiful in the world. We are super excited to announce that the groundbreaking series Pedigrees to Pups is now streaming live on Doggett. Dr. Marty Greer and I teamed up to offer a complete 360-degree mentoring experience. We're blending advanced reproductive science with that intuitive breeder's eye. You can stream the series today on your Doggett app. If you're unsure, visit puredogtalk.com to get connected. You can answer the call to pursue that one impossible thing. The chance to preserve, protect, and improve something that truly matters. Curiosity question, just because pH has factored so heavily in this conversation. Do they need to drink like bottled water? Because water pH levels fluctuate radically depending on where you live.
Yeah, and it also has to do with minerals in the water. So
Mm-hmm.
some places have more minerals in the groundwater, in the drinking water, in the tap water. So yes, some of these pets are better off with a distilled water, not just bottled, but distilled. And I know that there's sort of this trend right now toward drinking alkaline water for people. They feel like some people feel it might be healthier, other people dispute that.
Huh.
But alkaline, again, if your cat has the kind of stone that they shouldn't have an alkaline water, then you should talk to your veterinarian about what pH the water should be. And those are easy things to check. You can go to the
Mm-hmm.
store and buy fish pH paper or a pool pH paper and monitor the pH levels in your drinking water and the cat's drinking water. You can monitor their pH in their urine if you have the ability to collect the urine with these little kits. And those little beaded pellets, you can rinse them off and dry them and then use them again. They're not a one use if you have a cat that has recurrent problems. So you just lay them out on a paper towel, wait till they're dry, and then put them back in the little cup, and then you're ready for the next time that you need to collect a urine sample. And some cats would actually benefit from a fairly regular urinalysis to monitor the pH and for blood. So those would be things that you could do really easily with these cat kits or with something that your veterinarian can send home with you.
Fascinating. Um, and so you talked a little bit about like the different types of
Hmm.
bristles. Um, you said struvite was the most common. Did I understand that
Hmm.
correctly?
Hmm.
Again, is that caused, you say, by different levels of chemicals being out of balance, minerals
Hmm.
being out of balance? Is that right?
Yeah. So struvite is short for magnesium, ammonium, and phosphate. So those are the minerals that
Sure.
compose struvite
Sure.
stones. So yes, yeah. And in dogs, particularly struvite stones, we know are related to infections, bacterial disease
Mm,
in the bladder. In cats, it's not quite as strong a correlation. And in fact, it's been a change in the last few years, probably the last 4 or 5 years in veterinary medicine, that just because we see bacteria in the urine doesn't mean every patient goes on to an antibiotic.
mm,
And again, this gets to be a little bit confusing. So just because there's bacteria there doesn't mean the cat needs an antibiotic. But if they culture something and it's consistent and the cat has symptoms that go with it and they have white blood cells in the urine, then they
mm,
may go on to an antibiotic.
mm,
And antibiotics may be used for 3 to 7 days. They may be used for a much longer period of time, depending on the cat, the frequency of their infections, if it's truly an infection, all this stuff. So I think it's important that you are aware that this is not purely an infection. Many of these cats, if they have bladder symptoms, are going to be put on something like amitriptyline to help them not be as stressed. They may be put on gabapentin to relieve some of the discomfort that's associated with this gritty material in the bladder and the urethra. And you can imagine how that feels. If you've had a bladder infection, you pretty
gross.
much know. Yeah. So, the cats have a good reason to be complaining and to be uncomfortable and to be urinating frequently. It's not their fault. It's because they truly do have a medical condition. So there's definitely meds that are not antibiotics that can be used for these cats. There's some discussion about whether some of the glucosamines that we frequently think of for joint pain can be helpful. There's discussion about whether we should put them on a steroid or a nonsteroidal, but there's no studies on nonsteroidals in cats, and
Mm,
the only nonsteroidal we have for cats is listed as to be used for 3 days in a healthy cat. Well, is the cat with a bladder infection healthy or not? Blah blah blah. So it can be a lot of confusion. So
mm.
this is not something that's easy for you to just pop into your vet clinic and expect this to be a 15-minute in and out urinalysis. Boom, you're done. It can be a good deal more complicated. The other thing that I think is really useful is the Ohio State University has a whole series of web pages that are pages upon subpages upon subpages that go into managing cats with behavioral issues, and it's called the Indoor Cat Initiative. You can Google
Mm.
that, you can find it.
We'll put a link.
Very, very, yeah, very, very good resource for a lot of information. The University of Minnesota, where Carl Osborne was and Jody Lulick were, that has a lot of great information on bladder disease. It has charts based on the kind of stones that they can see or what they see on the urinalysis, and then it has algorithms. So if you scroll to the bottom of the page, you can find the algorithm. There's a lot of really good information. But please go to a veterinary site like the University of Minnesota, like Hills, like Royal Canin, like Purina. Don't go to your Facebook page support group for cats with bladder disease, because these people will make you insane.
Uh, is that where you hear things like "just feed it cranberry"?
Yeah, exactly. And cranberry can be the exact wrong thing to do depending on the pH. So again, it's really important. Some of these cats end up with a bladder infection that or bladder problem that leads to a stone. Some of those stones can be dissolved with the right diet. Some of them can't be, so these cats may end up in surgery. And like I said, the recurrence rate is super high on this. So you want to be absolutely diligent on getting the cat in for care, going back for your rechecks, doing all the stuff that your veterinarian is making recommendations for. And it's not just because they want to charge you a lot of money. You can go to the algorithm on the University of Minnesota's Urolith Center website and take a look and just follow those recommendations. There's some really great information there. So take advantage of using that and do the best you can to minimize all the stuff. Make sure they have enough to drink, make sure they have as little stress as possible, make sure they're on the right diet, do all the right things, and your cat is likely to have a much healthier outcome. Occasionally we will have male cats that will end up with frequent enough obstructions that there's a recommendation to do a surgical procedure. It's called a perineal urethrostomy. It's a PU for short, and that is where the urethral area is replumbed out of a male cat. So essentially removing the male cat's penis and replumbing it so that it is more like that of a female. This again is a big deal. Carl Osborne, the guru of all urinary things, used to say that he considered it to be malpractice unless you could prove that the cat had a structural defect to do that. Now, I don't know what Jody Lulick has been saying. I'm not sure if there's other changes to that, but that always rings in my head when I hear someone that says, I went to the emergency clinic, they said PU was the best choice. Well, the problem with the perineal urethrostomy is that it then removes the normal anatomical barriers to bacteria ascending into the urethra. So the cats are actually more likely to have a bladder infection with bacteria than they were before the surgery. They are less likely to obstruct. I'm not going to say they'd never obstruct, because if they don't heal well and they scar, they can still have an obstruction. And then you have a really terrible problem. But this is not a procedure that you should jump into at the first sign that your cat has a urinary issue. It's better managed with diet. It's better managed with medication. It's better managed with water and stress. But if the cat can, if you can prove the cat has a structural defect predisposing them to an obstruction, then it may be an appropriate procedure. I personally have been taking care of a cat until recently that had a PU done, and he had a lot of problems. That's where we really got into the conversations with the referral center about just because there's bacteria doesn't mean he needs to be on an antibiotic. So be aware that some of these things have changed, and keep up to date, and then have a really heart-to-heart conversation with your regular veterinarian before you jump into some of these procedures. Do some reading about it. Make sure that you're following the current recommendations. And although this surgery sounds like a panacea for preventing the obstruction, it's not without its risks.
I have one completely off the wall question because I'm not a cat person. You keep saying that the cats should have less stress, which is great, and you should just put them in their own room. If you did that to a dog, the dog is more stressed. Is the cat less stressed if it has an away space like that?
Yes.
Inter-
Typically, yes. Most cats are not that social. I mean, they have a social component to their personalities, but there are definitely cats that are going to be more stressed when they are in a tight confinement with a number of other cats. If there's maybe one or two other cats in the house and they've got the whole house to roam through, it's not bad. But if you have a lot of cats, if and a lot of people do, we have clients that have 8 or 9 or 10 cats. That's not unheard of. But those cats can be just really stressed because there can be some social interactions that can be difficult to determine that are happening. If you have a social interaction with a dog, it's usually pretty clear when it's a negative social interaction. It's pretty obvious to even an untrained eye, but cats are much more discreet and much sneakier about how they have negative interactions with other cats. And so I've taken 2 5-week courses, 3 5-week courses of, no, make it 4, um, behavior with Karen Overall. It's 4,
Yeah.
2 in, yeah, 3, 2 in Florida, 1 in Prince Edward Island. And she's an amazing behaviorist, but she would take videos that clients had sent her for their consultations and show them to us. And it was be really interesting because the client would not have picked up some of the negative interactions that cats were having with one another in a way that all the veterinarians in the room were like, "What? Did you see that?" And it can be really subtle because cats are they're not dogs. They are not small dogs. And they're not potted plants either. They're not furry potted plants. They have personalities. They move. They're all these really interesting nuances that happen. But there can be really subtle interactions. A cat that just sort of quietly lays in the hall and doesn't let the other cat go down the hall to get to the litter box, or a cat that doesn't let the other cat get to the water or the food or to the window that they like or to whatever. There's all these things that may not turn into a full-blown, rolling,
Cat
screaming
fight.
kind of a cat fight, but it's enough to say these cats are not having positive interactions. But let's face it, this happens to people as well. There's those negative interactions in the workplace. That person that
I'm
somehow
going to go the
very
long way around so I don't have to walk by his cubicle.
a lot of those things, so those subtle emails, those subtle text messages, those things that they're just that little bit of a dig. It happens in people too. So we shouldn't be all like, "Ooh, why would a cat be like that?" People do the same thing to
Catty,
one another.
the term catty is the term for a reason.
Bingo. Yep, you've got it. So there's absolutely no question that there is an interaction that happens in cats that's significant.
Yes.
So that's the tricky part, is that it can be really difficult to pick up on some of these changes and some of these interactions. So really pay attention if you're in this setting with an issue. Make sure that there's enough litter boxes. The rule of thumb is one per cat plus a spare, but it may require more than one. And it shouldn't be that they're all in the basement, because as your cats get older and creakier with their joints, it's hard for them to go down to the basement and get back up the stairs. It can be hard for them to get past the other snarky cat. It can be difficult if they don't like where the litter box is. If it's next to the furnace and the furnace kicks on and it makes a weird noise and it scares them, it's like Kevin in Home Alone. Ah, I can't use a litter box. And cats will take any negative interaction that happens in the litter box, including pain from a bladder problem, and then associate that I went
Right.
to the litter box, it hurt when I urinated, I'm not going back to the litter box.
Right.
So that's when they start urinating in inappropriate areas.
Got it.
Cats don't miss. If the cat's not using the litter box, they don't miss. When you watch a cat, and I'm sure you haven't, but I have,
Yep.
dig a hole and then they look and then they dig it a little bit further and then they look and then they dig it a little bit further and then they look and they aim and they nail it exactly with where they urinated or defecated. They know exactly where they're going. They don't miss. So if they're not using the box, or if they're standing on the edge of the box with all 4 feet perched like a bird, if any of those things are happening, your cat is telling you something, and it's smoke signals that your cat is saying, "Okay, I need a veterinary visit before I obstruct. Hello, I have a problem. Hello, I'm going to obstruct. Take me to the vet." Don't ignore these subtle changes, because it will save you thousands of dollars to go in now. We've talked a lot about the cost of veterinary care and prevention. This is your cat's smoke signal, and cats are subtle about a lot of their medical conditions. They don't tell you they can't breathe until their last alveola is compressed. They don't tell you anything early. If they're telling you this, pay attention, get an appointment, see somebody that can collect a urine sample, get a urinalysis, get them on the right diet. Just absolutely, you've got to do this before you end up in trouble. And don't let it freak you out that they're going to do a urine sample with cystocentesis. The cat doesn't care. I would care if they did that to me, but the cat doesn't care. They're cool with it. We put a little alcohol in their belly. We put the probe on. We know exactly where we're going in and out. We've got a nice clean urine sample. It's the information we need. What is the pH? What are the crystals like? Are there bacteria? Are there white blood cells? All the stuff that we need to know to get them on the right diet, the right medication. So please, please, please make an appointment with your vet, get in there, and take your cat with a full enough bladder that it's easy to get a sample. And if your cat is difficult to take to the vet, ask for gabapentin before the appointment. We usually give 100 to 200 milligrams 2 hours and 8 hours before the veterinary visit, so that when you put the cat in the carrier, they are calm enough that you can drive like down the highway without, you know, all the distraction of the cat in the back seat making
Squalling.
unhappy
Does
noises.
it work with cats like it does with dogs, where if you put a little towel over them and give them a bird cage cover, that they feel safer?
It helps. But cats that aren't used to being put in the carrier are not going to tolerate the car very well. Dogs are much better in the car in most cases than cats. Now, I personally had a cat that had 50,000 miles on her. She was wonderful. She was awesome. I got her in California. She rode back and forth to Iowa, to Minnesota, to Wisconsin, to California, to Phoenix. She was everywhere with me. But that is not the typical cat. The average cat is not happy about riding in the car. So gabapentin is your friend. And most veterinarians are very happy to hand you gabapentin because it will make their life better and your life better. It comes as a liquid, comes as a capsule. You can open the capsule. So ask for gabapentin. It's also the drug that we use to treat this disorder. So just because your cat got better on the gabapentin before the veterinary visit doesn't mean you should cancel the visit because your cat feels better. You're going to need a much larger supply.
Amazing. All right. Well, kitty bladders 101. We nailed it. We got this.
I like cats. I like bladders. There's a lot of good information.
It's a happy marriage then. To me, it's all Greek. So that's, my job is to ask the questions because I don't know the answers.
There you go.
Awesome. All right. Thanks, Marty. Stick with us next week. We'll actually be doing the same treatment to dog bladders. So that I know much more about.
Different experience, different species.
Entirely. All right. Thanks, Marty. Have a great day.
Thanks.
Hey, friends. Did you know that the Marty and Laura Show website has a special page just for young animal lovers? Whether your child is meeting their first pet or already dreaming of becoming a veterinarian, Kids Corner is a place to explore animals through creativity, curiosity, and age-appropriate learning. Designed for young animal lovers and their families, these resources encourage empathy, responsibility, and a lifelong love of pets. Start off with a free coloring page. That's right. A new coloring page is available regularly. Download one free and check back often for new designs. And if you love that free page, take your coloring adventure further with the 10-page Color Me Pets coloring pack for just $5. Each page is filled with adorable, breed-specific dogs and fun educational prompts that spark creativity and curiosity. This pack is perfect for kids who want to explore, who want to color, and who want to discover more about pets. It encourages careful observation, fine motor skills, and an appreciation for animals, all while providing hours of fun. Plus, it's an easy, printable download, perfect for rainy days, long car rides, or creative play at home. Artwork by award-winning artist Sandy Mesmer, the Color Me Canine Collection brings even more adorable pets and fun designs. Explore full coloring books available online through Sandy's shop link on our page. Visit martyandlaurashow.com/kids-corner to learn more. Thank you for joining us on the Marty and Laura Show. We're excited to bring you these unique, fun, fact-based conversations about pet health. We hope you'll join us on social. Stop by the website to sign up for an extra tip of the week for your pet. While you're at it, do us a favor, please, and leave a review wherever you find your podcasts. The Marty and Laura Show is produced by Pure Dog Talk, Inc., sound design and editing by Premium Audio Services.